um, we also do have Aspire Indiana Health. We call it AIH. We operate as a FQHC and a community mental health center as well. So at Aspire Indiana Health, we do try to serve all clients that come through our doors. Doesn't matter if they're deaf, blind, have additional disabilities co-occurring. We try to provide quality care to anybody that comes through our doors through different services and modalities. Most importantly, we don't send anyone away due to lack of insurance. Obviously, if you do have insurance, we have a lot of service lines available. These are the insurances that we accept. And even if the client has Medicaid, Medicare, HIP, as primary or secondary, we are still able to work with them. We have therapists on staff that are able to see them. We additionally serve those with the BPHC, the behavior health, the BPHC, and those that have serious mental illness and those that have any physical needs. We have primary care available through Aspire Indiana Health. So we specialize in behavior, mental health, and primary care. So with the MRO, we use those options as opportunity to provide different service lines like skills, life skills training, things like that. And because we are the FQHC and the Behavior Health Center, we are able to provide direct care. And we do that with our deaf staff that we have on hand. We have deaf CCLSIs, care coordinator, life skills instructors, deaf therapists, deaf front desk staff. We have deaf certified interpreters. So we have a whole host of staff that work within our organization. That is beneficial because they just have a rich experience and bring that deaf knowledge and that deaf life experience to their care to be able to best coordinate the needs for our deaf patients. And so here within Deaf Services, we are just a one-stop shop. We are unique within our agency, being the only community mental health center that services the deaf in the state of Indiana. And the other unique thing about our program is we do have staff interpreters at the ready. We have 4 of them, and they all have degrees and credentials. They've gone to mental health interpreter training where they have in-depth knowledge and additional training specialized in working with mental health and how to work with providers and how to best provide care for our deaf patients. They're able to interpret it within different modalities, not just American Sign Language, but also working with Pidgin Sign English, oralism, lip reading, and things of that nature. And our interpreters are also trained and equipped with tactile interpreting to be able to work with those who are deaf blind and need that interpreting in the hand, and also assisting site support people to help manage the flow of communication with our deaf blind clients. Our interpreters continue their credentialing by acquiring CEUs to follow the Registry of Interpreter for the Deaf guidelines. And so that recertification is every 4 years. And so they continue to go to workshops to maintain their certifications. We currently do have several deaf employees that work in a variety of departments at Aspire Indiana Health. Like I said, we have the deaf therapist, deaf CCLSI, the care coordinator, life skills instructor, employment specialist, the front desk staff, and we also do have notably 2 deaf maintenance guys. And the services that we provide is a whole host of services here, but notably, we have outpatient services, the whole continuum of care, ages 4 to 99, what have you. And within that, we have primary care, psychiatry. We just added OBGYN. So those are our in-house services. um the specialty care, we're able to send referrals out for like rheumatology and things of those specialty service lines. We do partner with local hospitals in the area, strong partnership with Community North, Community East, and working heavily with the state operated facilities like Logansport, Evansville, Madison, Richmond, the NDI, the Neurodiagnostic Institute, at the Community Northeast location. So we have working relationship with those state hospitals. We have EOP, extended outpatient therapy, BOP, the basic outpatient therapy. And we also have substance use addiction services through Mockingbird Hill and Progress House to help with those addiction services. One of those is in Anderson, and then the other one is here local to Indianapolis. We provide support groups for adults and teams, and teens. And so what we do is we plug in that deaf person into the hearing group, and then we send an interpreter with them to be able to access support group therapy, anything ranging from addiction, anxiety, CBT for adults and teens, growing in grief. These are just examples of the different support groups that we have to offer. We also have a deaf employment services worker. So she herself is deaf, and helps deaf people find jobs. We also have a lot of referrals coming in from the Indiana School for the Deaf, and we work with schools all over the state um, for the deaf services, but mostly the 5 donut counties, like Marion, Boone. We will be adding services to the Hancock County and to Shelby, so that will be coming soon. We also provide services for crisis. We have the MCT, the mobile crisis transportation. So if a deaf client were to be in need and needs to be transported to the hospital or transported to a shelter or any other emergency services, we get that coordinated with our crisis team and get the interpreter set up to be there, and we'll meet them where they are and get them the care that they need. And if you are wondering kind of what the process looks like here at Aspire, like how everything works out, we have a process what's called SDA, same day access. And that same day access is available at all of our locations and in the counties that we serve. So deaf services, they're welcome to come to the Willowbrook location. And we have our listed hours Monday through Thursday, 8:15 to 3. And then on Friday, we have a shortened time, 8:15 to 1. And so this is an important part of preparing the client for services. We get their registration going, driver's license, ID, insurance, what have you. And usually this intake process is about 2 hours in total, sometimes can be 3 hours, depending on the deaf client and their communication needs and the severity of mental health concerns at hand. And so when the client comes in, they just walk off the street. If they are notably pregnant, then automatically we get them connected and set with additional appointments. And if they are pregnant and an active user, in any kind of substance. We'll get them assisted with those ongoing treatments as well. If they have a history of addiction and with pregnancy, we'll do the same kinds of services there. But if there's a deaf patient that walks in off the street and doesn't have any of like the pregnancy concerns, then we will get them going in a regular intake, same day access. So they'll check in at the front desk, get the paperwork and the screeners filled out, get the ROIs taken care of, and the consent to treats, that kind of paperwork, just that preliminary paperwork before the intake gets going with the clinician. They get called back with the clinician, and the interpreter is there for the duration at the ready for their intake. And our interpreters are notably scheduled in person, and they are ready and available as soon as that deaf person walks through our doors. The notable thing about working with the deaf and hard of hearing community, there's some things that are common within our community, specifically access to quality care. It doesn't matter if we're talking primary care or behavior health. And the reason behind that is because deaf of hard of hearing come to the appointment with lack of knowledge. They don't have the fund of knowledge that hearing people gain in their everyday life. Those accidental learnings that you may just happen to oversee or overhear within the community, listening to the news, the TV, listen to your family talk about gossip and situations that are unfolding within their family. And so we're trying to navigate the world without being able to hear these situations going on and being able to learn from other people's experiences. And so we're having to use our visual modalities of reading and body language, but it's still not 100% accessible to us in the same way that a hearing person is. And so that fund of knowledge just continues to uh, be an issue throughout their life. And so that just compounds the lack of trust within the healthcare system, their lack of knowledge of how the healthcare system works, how the healthcare system can work for them within primary care or psychiatry, just that lack of information, just not having basic fund of knowledge that is usually available to the hearing population. We do have notably language delays and language deprivation within our community because 90% of deaf kids are born to hearing parents. And so the hearing parents are trying to figure out the best way to raise this deaf child. Should we force them to speak and learn like English and do the oralism approach? Should we work with them and use sign language to work with an interpreter? And so the parents are freaking out and trying to figure out how to accommodate this child during this critical learning period. And so just the lack of exposure to knowledge during that critical learning period can have long-lasting impacts on their language. And then with all of that, it can cause, like, especially without having interpreters in the doctor's appointment, it can cause to misunderstandings, misrepresentation of symptoms, and ultimately leading to misdiagnoses. And so our population, um, it can be like mistreated, misdiagnosed. And our goal within deaf services is to help bridge the gap and lessen that gap and be able to provide as much access as possible for high quality care for our deaf population. So here at Deaf Services, we prepare on a daily basis to do all that we can, but also what can you do as a hearing person if a deaf person comes in and needs services. Um, we we do like the entitlement, primary care, um, therapy, and all of that. But what can you do as a hearing person when a deaf person walks in off the street, making sure that they have accommodations and providing a sign language interpreter, making sure that they get assigned to a deaf provider if we have one, being able to request a certified deaf interpreter if they're needed. I'll go into that a little bit later as to what that means, a certified deaf interpreter. But just providing that well-rounded care to our clients from the start, whether you're deaf or hearing. So interpreters will be requested for anything and everything that we provide at Aspire. As an example, intake, the pre-intake, and the full intake session, that all falls under the same day access, primary care, therapy, wraparound care, crisis services, employment services, legal that we have in-house, housing specialists that we have at Aspire. If they get sent over to our Mockingbird Hill treatment facility, we'll get interpreters there. We do have an internal form, an internal request form to get those interpreters situated and where they need to go. And then we also have the Google Calendar to help get the interpreters to the assignments with the deaf people. And here we have a just kind of diagram to explain the process of a certified deaf interpreter. You'll see a hearing person, the hearing interpreter, the deaf interpreter, and the deaf person. And this just helps the deaf person to better understand the information at hand within the appointment. The CDI is important for several reasons. They could be working with children who language hasn't quite developed and they might have language delays, or if they came from another foreign country and is deaf and knows a foreign sign language, a certified deaf interpreter could help bridge that gap. If they have minimal language skills, like they didn't go to school, they didn't have socialization to be able to acquire ASL, bringing in a CDI is great for that. Mental health and receiving services for mental health can be tough to navigate within the system. So just pulling in a deaf person to help mediate that and be like, hey, I'm deaf too. I'm on this team. I'm here to help you. Kind of best mediate the cultural differences between the hearing and the deaf world. So this diagram is just a good well-rounded explanation as to what the team could look like for a deaf person. And so as a hearing person, how can you be deaf friendly in working with deaf clients? Just making sure that you are visual when you can, using links, pictures, diagrams to provide as many visuals as possible. You speak normally. You don't have to enunciate your facial expressions or your lips or anything. Just speak as you could, as you normally do, but do be ensured to maintain that eye contact. Same with hearing people, but that eye contact is even more important within the deaf community. If you are giving them information in working with a deaf client, we always appreciate your patience, as sometimes it does take a little bit of extra time. And as Zoe kind of explained earlier, you can see about having the camera on today. We like being able to have access to facial expressions, to be able to see tones and moods of the people that we're working with. And this is just an example of a diagram at the bottom to be able to show just another visual chart that you can use to gauge the range of emotions. Like if somebody has minimal language skills, language deprivation at play, maybe for children, this would be a great little chart to reference where they can express themselves. And then along the side, we have a second chart that you could pull up and use, just another example of a visual diagram that would be great to use with a deaf person. That this one notably has like the emotions with the color gradient, and then the simple language on the side. So ultimately, our goal is to have greater healthcare outcomes for our patients and just have better overall healthcare experience, thus decreasing unnecessary labs and testing, and increasing patient satisfaction, increasing that patient compliance because they trust their team and they become healthy and stable, and showing up to appointments because they trust their team and following through with their healthcare plan. So deaf services at intake. One thing to note within the within SDA, the same day access, whenever they do come in for that intake, it's not the standard intake questions that they are going through. Our clinicians are trained and have expectations to ask specific questions pertaining to the deaf community, pertaining to our identity, our culture, our community connections, because our deaf community here locally is pretty big. And so we do have deaf clubs, we have deaf sports, deaf politics, deaf groups. We have like Indiana Association for the Deaf. Um, and so we have a variety of programming for like deaf children, or maybe hearing children that sign because they are children of deaf adults. And so we ask those kinds of culture, language, and identity questions during our intake to be able to capture that. Are you guys still with us? Or are you guys nodding off over there? Cool. Awesome. Wonderful. And if you want, feel free to hit any of those emoji buttons and communicate what you're thinking on your end. But so all of this with the deaf culture and just understanding how deaf people work, it's just important to know so that way we can all be culturally sensitive and working with the deaf population. So I'm going to hold this for a few seconds so you guys can read. I'm sure you guys' brains are giving out. It's like drinking water from a fire hydrant. A lot of information coming at you. And also notably, like sometimes you understand deaf people and their signs. You're like, oh, I caught what they said, but then sometimes I have no idea what they said. And kind of the reason being behind that is deaf people identify in a variety of ways. Some labels here, not just deaf. There's the medical view of deafness with the diagnoses of hearing loss, little d deaf. And then we also have what's called big D deaf, and that's a that's a cultural identity, meaning you socialize within the deaf community. You were born and raised using sign language. You go out and socialize with deaf people, and you're involved with deaf organizations, deaf school, what have you. Then we have hard of hearing. That could be somebody who was born hard of hearing, or maybe they're hearing and due to old age or accident or illness, they may or may not sign, but they just have that hearing loss component. So we do see that within our community, those that identify themselves as hard of hearing. We also have deaf blind. The deaf blind diagnoses can vary. That can be genetic, or it can be again from accident or illness that could cause them to become blind and or deaf. And some people are born blind and then become I'm sorry, some people are born deaf and become blind later in life. Some people are born hearing and have no exposure to deaf culture, and they operate as a hearing person in the hearing world. They don't use sign language. They may identify themselves as late deafened. So they are a hearing person operating in the hearing world, and don't culturally associate with deaf people. And so now they're like, man, I became deaf later in life. I'm having to find a new community, new skills, all this as a hearing person becoming deaf later in life. So this part can kind of be tough to understand. This kind of goes back to that image of like, sometimes I understand what they're saying and sometimes I don't. This is kind of what we're working with. The ASL to English language continuum. We do have a variety of modalities in which deaf people will use language. So they may use American Sign Language, they may use conceptually accurate signed English, sign supported speech, sign exact English. So there's different modes of communication that deaf people may communicate with. And so most notably in all this, it's important to recognize that ASL is usually the primary language for deaf people, and English is a second language, and that can be a barrier to getting treatment and being able to operate in a hearing world. So just things to note. But that kind of brings us to time. And do we have any questions?
Are there any questions from those of you that are on regarding Aspire's deaf services or any thoughts?
Good
And you
morning.
can. Yes, hi, Donna. Danica, how are you?
Well, thank you. I just wanted to know if we could have their contact information.
Oh,
Yes, we will
yes.
be. Yeah, we will share that in the chat there if you wouldn't mind, Sarah, putting in how we could reach out to you.
Thank you.
Yep,
We are
I will
getting a
get that in
lot.
there.
We are getting a lot of folks in the chat that are saying thank you for a great overview and a great scope of service, and people really appreciated you sharing. Any other questions from the group?
Sylvia, how many people do you serve a year?
In total, the numbers do fluctuate. I would say 300, 375 or so unique individuals, because we do work in all 92 counties for therapy. And then we are local to like the donut counties and then adding those 2 new counties. So we do project that our increases are our numbers are only going to increase. And then with that home and community-based services. So we are growing.
Thank you.
Great question. Any other questions? I know we are at time, but I wanted to thank the Aspire team for coming on and sharing about this wonderful service. I know at the Indiana Council, we have been messaging each other back and forth how honored we are to represent you and represent the great work that you guys are doing in state and federal policy. And I think all of us who are on can agree that we are honored to have you a part of our network. So thank you for leading this service. We do have a Cup of Joe winner, and that is Naomi Schrodat from 4C. Naomi, are you still on? You are our Starbucks winner today, so congratulations. And since we are at time, we will raise our cups and we will say cheers to a fantastic day. If there's anything that you guys need, do not hesitate to reach out. We'll make sure to share these resources, and thank you all for joining. Have a great morning. Take care.